Let's talk about the IVF जो
हम्म
टर्म हमने बात की थी, राइट? व्हाट इज IVF एंड IVF किन्हें करना चाहिए?
सो IVF इज असेंशियल. IVF का मतलब होता है इन विट्रो फर्टिलाइजेशन. इन विट्रो यानी बॉडी के बाहर, फर्टिलाइजेशन यानी फर्टिलाइज करना. तो बॉडी के बाहर जो फर्टिलाइजेशन होगा उसको IVF बोलेंगे. फर्टिलाइजेशन होता है एग्स और स्पर्म्स का. ओके, सो दैट्स IVF. किसको करना चाहिए डिपेंड्स on a lot of causes. People who are fertile can also choose to go through IVF if they want to delay their pregnancy.
ओके.
They could be fertile, but वो सोचे होंगे कि यार we are 35, 32, we don't want to have a child right now. We want a child say in the next 5 years. But तब तक उनकी natural fertility will decrease. तो वो IVF के लिए जा सकते हैं. They can have their eggs and sperms. If they are single, they can freeze them as eggs and sperms. If they are a partner, if they are married, if they are a couple, then they can make it into an embryo and then freeze the embryo. And the longest recorded pregnancy from frozen eggs and embryos are have ranged up to 27 years. इस
वाओ.
मतलब कैप्टन अमेरिका जो हमने एवेंजर्स में जो कंसेप्ट देखा था दैट वो
या
70 साल
या
तक फ्रोजन था. इट एक्चुअली हैपेंस. नॉट अ फुल ह्यूमन बॉडी बट द सेल्स. Yeah, so we actually do that. Like it happens all over the world at every single IVF center. And yeah, that's just IVF. Anybody can do it.
ओके. ओके. एंड व्हाट्स द मिनिमम कॉस्ट फॉर दिस
So the cost will vary. Okay, if you are in a tier 2, tier 3 city, it will be cheaper. In a metro, it could be costlier. The range for one cycle of IVF is anywhere between 1 to 3.5 lakhs
ओके.
for one cycle. And as freezing would come in, multiple cycles would come, because IVF is not 100%. The global success rate is 40 to 50%.
ओह.
Yeah, and natural pregnancy का rate होता है 7 to 17-15%. So it's a jump from that,
या
but it's not
या
100%.
डेफिनेटली.
Yeah.
गॉट इट. टेल मी वन थिंग, ये जो टर्म है एम्ब्रियोलॉजिस्ट का जो टर्म है, व्हाई डू कॉमन पीपल नीड टू हियर अबाउट इट अ लॉट? Because if you see tier 2 and tier 3 mein, there's no
Yeah.
much knowledge. I think even today they don't know much about this embryologist term or maybe IVF. IVF आज जाके सोशल मीडिया के वजह से मे बी इट इज़ बूमिंग, बट टीयर 2 एंड टीयर 3 में इसका क्या, व्हाट्स द स्टेटस अबाउट इट?
Okay, so because I live in Jodhpur, which is essentially a tier 2 city. And I understand it over there that it's very important that patients also talk to the embryologist and people know what they are, because IVF के अंदर सबसे important चीज़ होता है patient to be in a spot where they feel secured. Because जब वो आएंगे तब they're already scared. They don't know, they've been trying to get pregnant, बच्चा हो नहीं पा रहा है, तो they're already scared. Now first they need some assurance, because it's even IVF is not 100%. So
Okay.
just to convey it to the patient and make them feel secured, ज़रूरी नहीं कि इससे pregnancy होगी, but for them to feel a little stress free, it's important they talk to every important member in the team.
ओके.
So once they have spoken to the doctor, then they have spoken to the embryologist, then they have spoken to the nurse and the staff, which is who they will speak to on a regular basis. It's very important that embryologists are also out there talking to patients, explaining it to them ke how your eggs are, how your embryos are, sperms कैसे थे. इसलिए बहुत ज़रूरी है that people know what embryologist is.
बट देन हाउ डू यू मेक देम कंफर्टेबल?
So now that in medical, the first thing that we learn is जब हम medical college जाते हैं तब, that history taking, जो patient की history लेते हैं, is an art.
ओके. या
And people don't take it seriously in colleges, but when they come out of the college, that's when they realize कि अगर उस समय ध्यान दे देते, because you need to be very precise with what you're asking. Patient हमेशा ज़्यादा information देगा, हमेशा deviate होगा. So taking the correct history out and trying not to miss any relevant point is what history taking is. And it is an art. You need to keep working on it. So to make the patient feel secure, it's बहुत ज़रूरी है कि एक तो they have to realize कि उनकी गलती नहीं है, because society का pressure इतना है
ट्रू.
कि हमेशा वो उन पे रहता है कि ओ तुम प्रेग्नेंट नहीं हो पा रहे, एंड स्पेशली द विमेन आर ब्लेम्ड, विच इज़ नॉट द केस, बिकॉज इनफर्टिलिटी इज अफेक्ट्स एवरीवन. तो उनको सिक्योर फील कराना इज द फर्स्ट स्टेप, इज टू मेक देम रियलाइज कि होता है, इट्स नॉर्मल, जस्ट लाइक एनी अदर डिजीज. and then you go ahead and talk about the treatment.